Welcome to Be Well with MS podcast for people with MS and healthcare providers looking to live their best lives. I'm your host, Dr. Agnes Trokene, and in this episode, we have a special guest, Ellen Totten. Ellen is not only a person living with MS, she's also a MS patient advocate, but also a new mother who has recently given birth to a beautiful baby boy. Ellen was diagnosed with multiple sclerosis 8 years ago. Shortly, she started alemtuzumab medicine, and she's been in remission, living with relapsing remitting multiple sclerosis. She has been okay and feeling well despite all the challenges she has faced, and remained resilient and positive. Ellen has always dreamed to become a mother, and she was concerned about how her MS would affect her ability to carry and care for a child. She sought advice from her neurologist and obstetrician and worked closely with them to manage her MS symptoms during pregnancy. In this episode, Ellen will share her story of becoming a mother with MS. She'll discuss her physical, emotional challenges she faced during the pregnancy and after giving birth, and how she managed her MS symptoms during this time. Ellen will offer valuable advice to other women with MS who are considering motherhood, and she also discussed the impact of MS on motherhood in general, and including the importance of self-care for mothers with MS. So sit back, relax, and join us for this inspiring and informative conversation on motherhood and MS with our special guest, Ellen Totten. Welcome to the show, Ellen.
Thank you for having me.
It's a great pleasure. So we would like to understand a little bit better the impact of living with MS and becoming a new mother. So tell us your story. Share your story about being a mother with MS. How did you cope? How did you manage your MS symptoms during the pregnancy and after giving a birth?
I think for me, my journey becoming a mother actually started when I was diagnosed. So in 2015, I really had to consider my treatment options, because although I was only about 6 months into my relationship with my now husband, we had to really think about the future. And it was really important for me that something like becoming a mother one day, I could do on my terms, and I could have the enjoyment that other people have, and not have to worry about coming from medication and all the extra complications within that. So it started very early on, early conversations, and then 6 years later was actually when we got married and we had the conversations about starting our family, and things thankfully happened quite quickly for us. But it's always worth mentioning that although we were really fortunate to fall pregnant as quickly as we did, the process started so much longer before that, and the worries and the fears and the anxiety and the conversations had to happen very early on, and that it feels very unnatural in some ways to go against what you think that's going to look like before a diagnosis to what it actually could look like, and managing symptoms and symptomatic medication and everything else that kind of falls into place. We were very fortunate that I was in a stable position with my MS, and everything just kind of aligned at once, and we were just absolutely over the moon. I found out on Christmas Day that I was pregnant, so it was just a really magical time during the pandemic as well. So this was 2020 that I found out I was pregnant. I had him in 2021, and it's just been the greatest experience of my life, becoming a mother. I've learned a lot along the way, and I think there were a lot of things that could have prepared me better, even though I'm very forward thinking about my MS, and I wish other people would know living with MS about becoming a parent.
Okay, we'll dwell that in a minute. So what would be your advice for women who are a bit hesitant to become pregnant and to become mothers? You know, what would be your sort of initial immediate advice for women who are considering, but they haven't made their mind as yet? What would be your encouragement, to go ahead and to feel that normality being a woman and giving a birth to a baby, that you dreamed maybe in the entire life?
If you speak to anybody out there who has entered the world of motherhood, everyone has concerns. And if it wasn't MS, it would be something else. And it's just unfortunate the very thing that is impacting that is your health, and it makes you question your abilities. But you would be questioning your abilities regardless. I think that's just natural because it's a new thing, it's new territory, it's something you haven't done before necessarily, or maybe you have done it before but you haven't had a diagnosis and your circumstances are different. And it's understanding that it's not going to necessarily always be what you think it might be. Like, I was pleasantly surprised by my MS within pregnancy and postpartum, and how it has been since. And it's just about having those honest conversations. Like, if it's a real anxiety and it's something that's really preventative, that isn't okay. Like, you should be having those conversations with someone and making sure that you're talking that through. That's not something that you should have to kind of work out on your own. And speak to a neurologist, or whether it is a mental health professional, to really get that support and understanding that those concerns you have are so valid, but they might not actually manifest into what you think they're going to be, and the processes that you can go through to really make yourself feel confident in the decisions you're making.
Yeah. As neurologists, I would like to mention that pregnancy actually gives a lot of healing, a lot of resilience, a lot of good feels in your body, because hormones play a real role in multiple sclerosis pathogenesis. And somehow we see less disease activity whilst women are pregnant. And the most vulnerable period of time for women living with MS is after giving at birth. 3 months is a crucial period of time that we may see a bit of a more disease activity. However, some research supported if women are being exposed, or they used disease-modifying therapy before they become pregnant, the outcome, and after the giving a birth period of time, which is most vulnerable, 3-4 months, they somehow have less disease activity too. So planning your pregnancy is super important living with MS. Perhaps maybe going on the medicine, in particular if your MS is super active, you have numerous of the relapses and changes on the MRI scan. You want to stabilize your condition first before you get pregnant. Because if you are getting pregnant whilst you're vulnerable and fragile and having all that disease activity, it may be, somehow affecting you more negatively. So, of course, there are individual cases, and everyone is unique in their journey. And some women become spontaneously pregnant whilst they're having active disease. So nothing to worry about. There are ways to stabilize your condition. But in ideal world, if you can plan the pregnancy, living with MS is something that we would offer and pursue. So moving on to a bit of impact of MS on motherhood, and let's discuss the physical and emotional challenges living with MS and being a mother after you gave it birth. What are these challenges, physical and emotional? And then you probably have discussed with your peers about being a mother with MS and your own experience, what to expect after you gave it birth.
I find that one of my biggest frustrations throughout the whole process is the information that is out there is quite limited, and it made me worried because any way you read it, it's pregnancy. You're going to feel great. 3 months after, you might have a relapse. That's kind of the generic information. And one of the best things I did was actually call up my neurologist and say, well, I've had this really good treatment and I haven't had any relapses. What does that look like? Because this is a very generic overview of MS, and this was probably written before, treatments have advanced as they have, and you might not have factored in as many people being on these higher efficiency drugs. And she said to me, of the cohort of women that we've had through on your treatment who have fallen pregnant, who do present like you present, no one's gone on to have a relapse. And I know that she can't guarantee that that's going to be my outcome, but just the relief I felt, because I wasn't having that anxiety of, I'm going to feel great, expecting to feel great, or feeling disappointed if I didn't feel great. And then of that waiting after, I've got this beautiful baby I want to connect with, and that concern about what 3 months down the line looks like, that could have really consumed me. And I think that's important to say that I had these expectations really managed by just that one conversation. It was so helpful for me to hear. Throughout my pregnancy, I did naively think I might feel a bit better, but what does better look like? I wasn't really sure of that. And actually what had happened for me is I wasn't prepared to not look pregnant, not know what feeling like pregnant was before, but have a lot of pregnancy symptoms that mimicked MS symptoms. And psychologically, I found that really difficult. And I don't see that spoken about anywhere or enough in that aspect. So my bladder, the fatigue, the kind of like some of the aches and pains I might have had. There were just so many similarities that it automatically made me feel like, am I in a relapse? Is this a relapse? Because perhaps for me, that was the closest I'd felt to one for a very long time. And it wasn't. And as soon as the bump started to come and other symptoms were around, it was really easy for me to distinguish that. But there was that transitional period of not understanding and not being able to separate or being prepared for that. The rest of my pregnancy, it was a relatively standard, normal pregnancy. Unfortunately, I did have quite a traumatic birth experience, and mentally and physically. So my mind again went to, oh no, like what's going to happen for my MS? Recovery was inevitably longer for me because of the nature of it, and I had a C-section, and it was quite a longer, drawn out process. But it was fine. It was not really that much of a problem. I just took things in my stride, and I didn't try to think about the next stage. What will happen? Will this make me have a relapse? Will this stress, will this physical stress impact me in that way? I tried to really just think like, this is the moment I'm in now, this is how I'm feeling now, and anything that comes after I'll just deal with accordingly. And it really allowed me to refocus back on, again, this beautiful baby boy that I just had, and being a mother and enjoying that and being in the moment with that. Because what's the point in worry? If I'd worried about what could have happened next, I wouldn't have had those moments. They would have been stolen from me too. So it's just so important to be present and be there and not to have those concerns.
Wonderful. I think, Ellen, what you described, you did practice gratitude. You felt that you need to be strong, you need to be present in the moment and expect for the best. And almost like you prepare yourself emotionally that this is going to work for you. And, how do you talk to yourself really brings the future, whether it's going to be brighter or you're going to feel down with more and more physical and psychological symptoms. So really that preparation, I think, and I heard various different stories about doing the hypnotherapy, birth hypnotherapy, which is an essential skill that women may learn, and is coming from Australia. You can Google and search for this. Whilst giving a birth, you're doing some practices after you gave a birth. You still continue being that present moment without dwelling in too much into the future, looking backwards into your past, just enjoying that moment and accepting all these feels and sensations that is probably most likely related to the pregnancy. I'll give you an example that we start as neurologists, or MS nurses, we start worrying about you if you have, more than pains, more than fatigue, or other symptoms like, people with MS may develop optic neuritis, and that's the case in pregnant women. I've seen that a lot. And also various different more severe neurological symptoms such as paralysis, weakness, balance, and coordination that comes out of the blue. This is the time when you should focus and seek a lot of advice to your healthcare provider, because that's a significant change, and it's difficult to ignore. The niggles and pains in the pelvis, back, and a bit of a fatigue, a bit of a nauseous and sickness, a bit of a more headaches. It's not necessarily MS related. So distinguishing, and if you are not sure about all that presentation, you can always seek some advice from your healthcare provider. So that's very interesting to hear the story, Ellen, and how you coped. You're sharing a lot of resilience. You had a traumatic experience. It's always giving a birth. It's really a huge change within the woman's body. And Of course, there are risks associated and complications are there around the corner, and you start dwelling and worrying about that. But, if you are not giving a birth at home, it's under supervision in the hospital, you're really safe, these days. The medicine is really advanced and taking that pressure away from your mind, And I guess when it's your first baby, you get even more anxieties around this. And your second birth and the third birth is going to be much, much easier, and mentally you will be more prepared. But, there are cases that the second and the third birth is more traumatic than your first one. But treating things at the time in that present moment without putting extra emotions and feelings, thinking about the future, what future is going to bring. So let's talk a little bit about the self-care for mothers with MS. And are there any resources on the charity web pages that are available for mothers with MS?
So in terms of self-care throughout motherhood and even just during pregnancy as well, it's so important. It's so important to put yourself first. And I think with any mother, you spend this long period of time with us like, have a seat, sit down, and then suddenly the baby's here and it's all about the baby and not about the mother, and you can kind of neglect your own needs a little bit, and that's not good for the baby either. You really, really need to be looking after yourself. It's like that whole, if you're on an airplane, put your oxygen mask on before you put on somebody else's, and it's so true. With every aspect of life, you really need to be putting your health before others, and that sounds selfish, but if you're in a good, happy place, that will be contagious. That will help you to be in the best possible place to look after somebody else and to give that person their needs too. So it's so, so important. And especially if you are living with something like MS, because we can be harder on ourselves and we can be more reluctant to ask for help because we're scared of the consequences, perhaps. Speaking to a midwife or a health visitor about some of your concerns, if you have them, could also bring about this fear of what happens if they think I'm not a suitable mother, what happens if they're not a fit mother. They're not there to catch you out. They're there to support you and to give you that support and to make sure that you know where the resources are and to prevent anyone from going down into a position where they aren't in their best health. So my advice would always be to first and foremost to speak if you are feeling vulnerable or not feeling like you can look after yourself, to a health visitor or to a midwife or to a GP, whatever it might be, to seek that support, especially when your hormones are so all over the place. It is very easy to feel like you can't speak out, but no one's going to hold your MS as a factor against you if you are struggling. There are lots of resources out there. Sometimes it's about finding the ones that work best for you. There are lots of groups and forums and discussion groups for people living with MS. There are the information on lots of charity websites, but there are also, this will be the time as well to go back to neurology, and it might be that they haven't been kind of, your MS nurses might not have been so involved in your pregnancy, they might have not needed to have been, but go back to them at that point and say, I want to start conversations again about maybe the medicines I come back on, or support that might be out there, or if there are any other avenues that I might have missed in the context of MS and pregnancy that my midwife might not be aware of, and start having those conversations again. But just making sure that if you get a takeaway delivered or if you get your food delivered, you get to eat it first sometimes so it's warm rather than having to tend to the baby. The little things matter too. Like, they're making sure that you are putting yourself first and other people are putting you first too. And you're not kind of always just in the background and not kind of a priority.
This is really important. I could only add, establish your own routine, create the daily schedules that accommodates your energy levels and includes your rest breaks when needed, and always seek some support and advice from, your relatives, your spouse, your friend, your partner, just to give that sort of a physical and emotional support throughout the day, and simplify your meal planning. You don't need to have any fancy meals, just a simple something that you maintain your energy level, you plan, you prep your meals in advance to reduce the stress, ensure nutritious options for you and your whole family. always utilize assistive devices, whether you use the mobility aids such as canes, walker, just to conserve your energy and make activities more manageable. If you can delegate tasks, you don't need to do everything for yourself and your child, your baby. Ask family, friends to be around, to give you some assistance. To maybe you have a few more children in your family, somebody needs to do the school run and pick up the children. You don't need to do that on your own. And if you can, use also the technology, use smartphones, apps, voice activated devices to set the reminders, manage your appointments, stay organized. That's really important. And of course, we touched the base about being present, being in the moment, practice mindfulness, engage in activities like meditation or deep breathing exercises to reduce the stress, to improve your overall well-being, and also modify your home environment. Make your living space more accessible by installing handrails, removing the tripping hazards, and rearranging the furniture that you can mobilize. You can carry on the baby safely. There's nothing on your way that you potentially are at risk of tripping and having stumbles and falling down. That's really dangerous and unfortunate. Always stay hydrated. Super important. Particularly if you're breastfeeding, making sure that the water bottle is next to you. You are fully hydrated, because if you are dehydrated, your symptoms of MS will get worse and you may feel lack of energy if you're not careful with how much do you drink of still water a day. And always stay active within your limits, of course. Make sure that you have some level of exercises. After giving birth, perhaps it needs to be a gentle exercise, whether it's yoga, whether it's Pilates, maybe it's just walking, to start with around your block. Really keeping that energy going with the level of the exercise that suits you. Always plan for your downtime. Schedule regular periods during the day that you conserve your energy and you prevent your symptoms to flare up. Sometimes people may like to have a spa days or have a bath or go to the sauna, and enjoy that, or maybe read a book, and whilst your baby's having a nap, really use that time for nourishing yourself, to keeping your energy up, and simplify your wardrobe as well. You don't need to wear fancy clothes. Really focus on comfortable, easy to wear clothing, requiring minimal effort, with the elastic waistbands, slip-on shoes. But be careful with the slip-on shoes living with MS. If you have some balance coordination problems or weakness or foot drop in particular, avoid the slipping on shoes. You want to cover your heel, because that's the safest option to prevent you from falling down. And celebrate small victories. Recognize and celebrate your accomplishments, no matter how small they are. You just stay motivated and positive in your journey, living with MS and being a new mother. And then, have any special, your own experience that really played a key role managing the childcare whilst being a new mother? Anything from maybe that list, and give me an example, your real world experience.
100%. Listening to the list you were giving there, I could relate to a few and completely agree with them. And everyone is very different. It's finding those things that work for you and not comparing yourself to other mothers too, because other people do it differently. My son has always had a relatively late bedtime, but it's worked for us as a family. And I at first was like, oh, he's not in bed by 6 o'clock. He's still, up at X time. But if I had put him to bed at 6 o'clock, my husband would still be at work. And then by the time he's come home, I have just done the whole day of childcare. And this is when I was on mat leave and I'm back at work full time now. But it was in our best interest because he got time to bond with our son. He got to take on some of the responsibilities of, whether it's a few nappy changes or a few feeds within the period of time before he went to bed. And then it meant that we could almost do this shift of sleep where he would go up first and I would go up a bit later, and then he would do the really early feeds. And it just meant that I was getting out of bed later and my son was getting up later, but it worked for us. And obviously if you're breastfeeding, that could look differently. We unfortunately, we couldn't, but it's the formula side of things was really helpful, and having that bottle aspect there. One thing I really wasn't aware of before was about harvesting colostrum whilst you're still pregnant. So you can actually, as a mother, get some of that really nutritious milk that you produce before actually having your child, and you can store that. And that's a really good thing to have if you are living with MS, because you might, from that initial birth experience, feel quite fatigued and quite tired, and it would just be nice to have for some people. Not everyone can. So again, there's no pressures, no right or wrong. Not everyone, you're not a failure if you can do it. You're not if you can't. Like, it's not it's completely personal to you and your experiences, and just understanding that your needs are completely relevant, and other people would have them too. So for me, my preference is to use Zip Up Baby Grows. So the sleep suit, sorry. There's so many names for so many different things. Even now, I probably call them the wrong things, but you can get ones with zippers on rather than poppers. For me, for my fine motor skills, especially in the middle of the night, the difference between zipping something up, and although it's still quite fiddly, it's much more convenient than trying to get 10 poppers all in the right order and really get them together whilst the baby's wiggling about and all these other elements. You're all tired. So that was a really good thing. And having a changing unit that was at the right height and level for me, and having one downstairs and upstairs, and even feeding stations if you're on 2 floors, if you could manage that somehow, to have a feeding station upstairs if you are using formula, and one downstairs, to save that going up and down the stairs in the middle of the night. Just things like that can be really, really useful.
So stay clever, follow the Ellen's recommendations. I think they are super valuable. It's not written on the books. You barely can find that information and real experience. So, Ellen, a lot of women in this world, whether they have MS or they don't have MS, they're always worried about, am I a good mother? How would you respond to this?
I would always say that everyone's going to have those concerns. Everyone will. And for me, I've actually tried to change the narrative slightly, that although I am worried about my MS, I'm worried about my future, I'm worried about what that might look like for him, and the guilt that can come with that sometimes. It's a really hard but natural thing that is going to happen. It's going to be a thought process at some point, and that's okay. But it's understanding that you can make that into a more positive story. And for me, it's so important that my son grows up seeing me living with MS. And yeah, I will have bad days, but what I have achieved because of my MS, and what I do because of my MS, not despite of it, but because of that. And the way that I live my life, and the way that I treat other people, and the way that I am going to bring him up to see equality and want there to be justice and equity amongst everybody in the world. Like, I really hope there are values that I will give him, and the resilience I will give him, that I wouldn't necessarily have been able to if I didn't have a condition like MS. And I also have the benefit, it's a really horrible way to word this, but my husband's mum has MS. So I am married to a son of someone living with MS too. And he has turned out, I say perfectly fine. He's got his faults, but of course, but he's that's a real nice thing for me to say. So you're somebody who's living with someone who has a parent of, and someone who is a parent who has MS. It's not something that I think anyone should ever see as a negative. Look at some of the positives that can come from that, and if there are bad situations, you will have the resilience to deal with them if you have that support network around you and utilize it.
Wonderful. Such a beautiful explanation and story and encouragement and positivity that you bring into this world, Ellen. So I hope you enjoyed this episode of Be Well with MS on motherhood and MS. We hope that our discussion with Ellen Tutton has been informative and uplifting, and that it has provided valuable insights and advice for women with MS who are considering motherhood, or who are just about to become mothers, or who are mothers already, and carries on all the angles of the house and tries to juggle around. This is an extremely valuable episode, and Ellen's story is a testament to the strength and resilience of MS, people with MS everywhere in the world. She has faced the challenges of living with MS with a grace and determination, And her experience of becoming a mother with MS is an inspirational to us all. As we wrap up this episode, we want to remind our listeners that MS does not have to define us, and that with the right support and self-care practices, we can live full and meaningful lives. We encourage you to reach out to your healthcare providers and loved ones for some support, and to incorporate self-care practices into your daily routine to help manage your MS symptoms. Thank you again for listening to the Be Well with MS podcast, and we look forward to bringing you more inspiring and informative episodes in the future. If you have your own comments, please share that in the comment section. I read every comment on the media channels, and I do respond to everyone. I hope you enjoyed, and stay tuned. Thank you very much. Thank you, Hélène, for joining me on this episode. I really enjoyed our conversation. It's a magic for me to listen to your story, and I hope it's going to help to everyone living with MS and who are becoming new mamas in MS world. Thank you.
Thank you very much.